Gastro-Esophageal Reflux Disease, or GORD, is a common digestive disorder. It affects millions worldwide. GORD occurs when stomach acid flows back into the esophagus. This backflow irritates the esophageal lining, causing discomfort. GORD can impact sleep, eating habits, and well-being. Understanding GORD is the first step toward relief. GORD is primarily a mechanical problem. It involves the malfunctioning of the lower esophageal sphincter, or LES. The LES acts as a gatekeeper between the esophagus and the stomach. It relaxes to allow food and liquids to pass into the stomach and then tightens to prevent their backflow. In individuals with GORD, the LES weakens or becomes dysfunctional. This malfunction allows the acidic contents of the stomach to escape back up into the esophagus. The esophagus, unlike the stomach, is not equipped to handle the corrosive nature of stomach acid. When stomach acid repeatedly washes back up into the esophagus, it causes inflammation and irritation. This irritation leads to the characteristic burning sensation known as heartburn, the hallmark symptom of GORD. The backflow of stomach acid can also reach the throat and even the back of the mouth. This can lead to a sour or bitter taste in the mouth, another common symptom of GORD. GORD can be triggered by a variety of factors, ranging from lifestyle choices to underlying medical conditions. One of the most significant contributors to GORD is obesity. Excess weight, particularly around the abdomen, puts pressure on the stomach, increasing the likelihood of acid reflux. Hiatal hernia, a condition where part of the stomach protrudes through the diaphragm, can also disrupt the LES function, leading to GORD. Certain lifestyle habits can exacerbate GORD symptoms. Smoking weakens the LES, making it easier for acid to escape into the esophagus. Dietary choices also play a role, with fatty foods, spicy foods, citrus fruits, and caffeine known to trigger or worsen heartburn. Pregnancy is another common trigger for GORD. Hormonal changes during pregnancy relax the LES, while the growing uterus puts pressure on the stomach, both contributing to acid reflux. Certain medications, such as some painkillers and muscle relaxants, can also relax the LES and worsen GORD symptoms. Heartburn, a burning sensation in the chest, is the most common symptom of GORD. GORD can manifest in various ways, so recognizing symptoms is essential. Regurgitation, the backflow of food or liquid, is another sign. This often leaves a sour or bitter taste in the mouth. Difficulty swallowing or dysphagia can also be a symptom. GORD can mimic respiratory symptoms like a chronic cough or hoarseness. These arise when stomach acid irritates the throat and vocal cords. GORD can even trigger asthma attacks or worsen existing asthma. Symptoms can vary in intensity and frequency. Diagnosing GORD typically involves a combination of a thorough medical history, a physical examination, and specialized tests. The doctor will inquire about your symptoms, their frequency and severity, and any potential triggers. A physical exam helps assess your overall health. Endoscopy is a common procedure used to visualize the esophagus and stomach. A thin, flexible tube with a camera attached is inserted through the mouth and down the esophagus, allowing the doctor to examine the lining for any abnormalities such as inflammation or ulcers. pH monitoring involves inserting a thin tube through the nose into the esophagus to measure the acidity levels over 24 hours. This test helps determine the frequency and duration of acid reflux episodes, providing valuable information about the severity of GORD. In some cases, an X-ray of the upper digestive system may be recommended. This involves swallowing a barium solution which coats the esophagus and stomach, making them visible on X-ray. This test can help identify structural abnormalities such as hiatal hernia that may contribute to GORD. Treating GORD typically involves a multi-pronged approach that combines lifestyle modifications, medications, and in some cases, surgery. Lifestyle changes are often the first line of defense against GORD. These include losing weight if overweight or obese, quitting smoking, avoiding trigger foods, eating smaller meals more frequently, and avoiding lying down immediately after eating. Medications play a crucial role in managing GORD symptoms and promoting healing. Antacids neutralize stomach acid, providing quick relief from heartburn. H2 blockers reduce the production of stomach acid, while proton pump inhibitors, or PPIs, are the most effective class of drugs for blocking acid production and healing the esophagus. In severe cases of GORD that do not respond to lifestyle changes and medications, surgery may be an option. Fundoplication is a common surgical procedure that involves wrapping the upper part of the stomach around the lower esophagus to strengthen the LES and prevent acid reflux. Lifestyle modifications are an integral part of managing GORD. Elevating the head of your bed by 6 to 8 inches can help prevent acid reflux while you sleep. This can be achieved by using blocks under the bedposts or a wedge pillow. Avoid lying down for at least 3 hours after eating to allow for proper digestion and minimize the risk of acid backflow. Eating smaller, more frequent meals throughout the day can help reduce the pressure on the LES and prevent overproduction of stomach acid. Chew your food thoroughly to aid digestion and avoid large meals, especially close to bedtime. Certain foods and beverages are known GORD triggers and should be avoided or limited. These include fatty and fried foods, spicy foods, citrus fruits, tomatoes, chocolate, coffee, carbonated drinks, and alcohol. Maintaining a healthy weight through regular exercise and a balanced diet is crucial for managing GORD.